Thank you, Dr. Dickerson, for the introduction. As Dr. Dickerson said, I'll be talking about primary progressive aphasia, hopefully improving your understanding of it. So topics I'll include are primary progressive aphasia, which I'll refer to as PPA, some communication challenges that individuals with PPA may experience, some therapeutic approaches, and a little bit about the research we're doing. Some terms that may make it a little more simple to understand PPA. So aphasia is a language disorder due to damage in the brain after birth. So an aphasia can be due to something like a stroke that affects the language areas of the brain, or a neurodegenerative disease, such as PPA. And it's called primary progressive aphasia because it's a language disorder, so an aphasia that worsens over time, so it's progressive. And the most prominent problem is language symptoms. However, dementia, as Dr. Dickerson touched upon, is an overall term that describes a wide range of symptoms associated with a decline in thinking skills that reduces someone's ability to live daily life independently. In order to have a PPA diagnosis, the main problem has to be language, especially in the first 2 years of symptoms. Other symptoms may occur, such as in memory and visual perception and behavior, but that's typically after the first 2 years. And individuals with Alzheimer's disease or behavioral variant FTD may have communication difficulties, but it's not the primary problem. For instance, if someone with behavioral variant FTD has apathy, they may not initiate or engage in conversation as much. Or if someone is disinhibited, they may say inappropriate things or not pick up on social cues, as well as someone who doesn't have that diagnosis. Some other terms that may be helpful in understanding PPA: speech is the physical production of the sounds of a language through the movements of your tongue, lips, whereas language, you can think about that as the thoughts and ideas that are inside your head. Speech is the way of getting the language out, the physical production of getting it out. There are other forms of getting language out of your head, for instance, sign language or writing. I'll be going over the 3 different subtypes of PPA. A simple way of thinking about it is frontotemporal degeneration is an umbrella term. PPA, primary progressive aphasia, is the language variant, whereas the behavioral variant is more associated with behavioral symptoms. And under primary progressive aphasia, there's 3 subtypes. There's the progressive nonfluent, or sometimes called the agrammatic subtype. There's the semantic subtype, and then there's the logopenic subtype. As I'm going through and describing the different subtypes, I'll be showing short speech samples of different patients of each subtype describing this picture, so just try to keep it in mind. That's what they're referring to. The non-fluent and agrammatic subtype, as Dr. Dickerson mentioned, have non-fluent speech. So what I mean by that is it's effortful, it's a halting speech. They may have hesitations or pauses or articulation difficulty, so the sounds of the words may be incorrect or inaccurate. They have word retrieval difficulty, not as much as the other subtypes, but they have difficulty coming up with the names of words, even though they may know what the objects they're talking about are. Another feature is something called agrammatism, so difficulty producing and comprehending grammar. Reading and writing may be impaired for this reason, like complex grammatical sentences may be difficult to understand in writing or even in comprehension. Comprehension is typically relatively intact, but if a care partner uses complex grammatical sentences, it may be a little difficult. So this is an example of someone's speech with the agrammatic or
Bull flying a kite, boy buying flying a kite, and garage, car garage, parked in the garage.
As you can tell, some difficulty with articulating the sounds correctly, a little bit of pausing and hesitation in getting the speech out. The semantic subtype, however, they have fluent and grammatical speech. However, as Dr. Dickerson mentioned, it may be empty in its quality, so using vague words, maybe saying something like that stuff over there has a lot of things on it. So the content words really lacking in meaning, and the meaning of words, so what we call single word comprehension, they have difficulty understanding words that communication partners say to them at times. They also may have something called surface dyslexia, which is difficulty recognizing certain words in written forms. And this is an example of someone who has the semantic variant.
So they're sitting right there. She's playing something with it for maybe some water or something. He's reading an item.
So as you can tell, some vague language referring to things as item or over there. Lastly, the Logopenic subtype, they have inconsistent fluency, mainly because there's word finding hesitations and something we called phonemic paraphasias, where a sound of the word may be inaccurate, for instance, clate for plate. They also have impaired naming, and in testing, when we ask them to repeat phrases and sentences, they have difficulty with that because of impairment in auditory working memory. And this subtype, sometimes the pathology is Alzheimer's pathology in the language areas of their brain. And this is an example of someone with the logopenic subtype describing the picture.
A woman and a wife are sitting in having what do you do with it? You have things there, and the kids are all playing out there, and they live over there. And it's a picnic over here. They may also be the people who own the boat there, too.
As you can tell, there were some word-finding hesitations and some phonemic paraphasias that I were talking about. Some communication challenges that individuals with PPA may experience. So as you can imagine, it must be incredibly frustrating to know what you want to say but not get the words out. So they have to adjust to a new communication style, maybe not finding the exact word that they want to say to describe something. They may feel rushed to get their thoughts out because the communication partners that they're having a conversation with are talking more quickly than they are. A loss of previously enjoyed activities, maybe an increase in boredom, and feeling more self-conscious, because they may have careers where they have to be social and communicate a lot, and it's possible that they may need to retire, and then they have to adjust to a new way of living when you have communication difficulty. Sometimes it's difficult to really understand how much your loved one is comprehending when you're talking to them. Some ways to examine this are, when you give them verbal instructions, are they able to follow the instructions? Are they able to follow 1, 2-step, multiple-step directions? Is there a decrease in purposeful behavior? And we are more than happy to help figure out how much they're comprehending when you come and see us for research and clinic visits. Therapeutic approaches. Speech and language therapy can be extremely helpful, especially in the mild stages of PPA. Joy Shapiro-Gordon and myself think about ways for an individual with PPA to express themselves, even if it's not in the ideal way they would like to. So maybe instead of trying to find the exact word they want to use and their frustration and their anxiety increasing, maybe thinking, how can I talk around this word? What are some semantic features to describe a word rather than just using that exact word they want to use? Speech and language therapy, a key part of it is working with the caregiver. It's not just the patient with PPA who needs to learn how to communicate differently, it's also the caregiver. You know, what ways can they adjust their communication style to make it easier on the individual with PPA? Maybe forming questions in a way that's a yes-no response instead of an open-ended one, slowing down their speech, working with their loved one and thinking about, you know, when do they want help, when do they not want help, and how can they work together to communicate the most effectively. Assistive technology can be very beneficial, especially for people with the non-fluent PPA subtype where speech is difficult. There are different applications that can you can write things instead or it can talk for you. A physical communication notebook is very helpful sometimes too, so it can be organized in a way with pictures of family members, doctors, medication, favorite restaurants, parts of the house, and that way they can point to a picture and at least give more context about what they want to communicate about. So the overall goal is functional communication. So using the strengths of the individual with PPA to get their message across, even if it's not the ideal way of doing so. And PPA support groups can be really helpful, which gives me an opportunity to talk about the pilot program that our team has created. So we just finished a PPA therapy and support group. It incorporated 8 dyads of people, and most of which are in this room right now. So 8 caregivers and 8 patients, a bunch of staff members. So Joy Shapiro-Gordon and myself, speech pathologist, graduate speech language, graduate speech and language students, music therapists, movement therapists, Katie Brandt as our community resource specialist, and Dr. Dickerson. We had 8 weekly sessions and 4 monthly sessions, and the goals of the group were to improve functional communication, so learn and practice some of those speech and language compensatory strategies that I was talking about, learning about PPA and the research we're doing, utilizing music and movement therapy to enhance communication and connection, and providing emotional support to caregivers and patients. So we did pre and post surveys before and after the group, and what we found is not only did caregivers learn how to have more time to themselves and improve their health as caregivers, patients gained confidence in their ability to communicate, and most importantly, caregivers and patients felt less isolated, which in my opinion is a huge goal, right? So allowing people with PPA to find other people who are going through the same challenges, because it's unique challenges, right? And allowing caregivers who have an extraordinary amount of challenges that they're facing that are very unique too, to connect with one another. And we're lucky that our team is allowed to have these innovative programs to, even though they're not cures, to care for people who have these challenges in their lives. So that makes me able to tell people about, we're starting a new early onset PPA group that's focused on support. So if you have any questions about that, please contact me. And just to give a little idea of what we did in PPA group for music therapy. So thank you to all the people who are part of the group here today, because you allowed us to figure out how important that group is. Just briefly to go over research goals, I know Dr. Dickerson already went over this a little bit. We are looking to use tools to monitor and measure areas of impairment, specifically because when we do have a treatment, we need to know what is the typical progression of the disease, so that way we know if it's working or it's not working. We also want to further understand the subtypes of primary progressive aphasia. Most individuals fit into a certain subtype, but some, have features of different ones. So how can we modify the criteria to better fit more people? And Daisy Hochberg and Dr. Dickerson created something called the Progressive Aphasia Severity Scale, which allows us to take information from interviewing the patient and their loved ones and using testing as well as clinical judgment to look at all the different areas of speech and language to know what areas are remaining stable, which areas are progressing. So that way we have a better idea of a typical progression. So when someone comes in to clinic and says, what should I expect in 6 months, year, 5 years from now, we can give them a better idea based on individuals with PPA coming into our research lab and, going through that testing that I know is difficult. So it allows us to compare to other individuals who are experiencing the same thing. And Joyce Shapiro-Gordon and myself are running a workshop later in the day about communication strategies, so please feel free to come up to me and ask me questions, or Joyce. And thank you for having me speak today.